Hello, my name is Tamira McCurdy, and I will be discussing pacemakers today. So, what is a pacemaker? So, a pacemaker is a small device that's placed in the chest or abdomen to help control abnormal heart rhythm. Pacemakers are used to treat arrhythmias, and an arrhythmia is an irregular heartbeat, whether the heart beats too fast, slow, or early. And they can happen when electrical signals to the heart that controls the heartbeat aren't working properly. And then I just wanted to discuss what a regular regular heartbeat would be. So a regular heartbeat beats about 100,000 times per day. An electrical impulse is initiated through the SA node. It passes through the AV node and then spreads through the ventricles. And so that's pretty much what a regular heartbeat would look like. So that's just the difference between a regular heartbeat and irregular heartbeat. So how does a pacemaker work? So a pulse generator is implanted below the collarbone beneath the skin, and the leads are threaded through a vein located near the collarbone. And so the electrodes, they detect your heart's electrical activity and then sends data through the wires to the computer in the generator. If there's an abnormal heartbeat, the computer will detect the generator to send an electrical pulse to your heart, and then the pulse travels through the wire to reach your heart. And just like a battery, a pacemaker battery will run out over time. Since the battery is permanently sealed inside the pacemaker, it can't be replaced when it's low. So if your battery is too low, you will need a new pacemaker. As far as how long your battery will last, that depends on the setting your doctor programmed it to be, or how much therapy you receive. And so here I just wanted to show you guys a picture of what a pacemaker looks like. As you can see, like I said, it's located underneath the collarbone, and then as you can see, the pulse generator, and then you have the leads that travel to the heart. So there are different types of pacemakers. So first I want to discuss the pacing system, which is a separate but integrated component that stimulates the heart to contract with time electrical impulses. The pacemaker controls those electrical impulses along with a battery. The pacemaker acts as a backup that fires as needed when the SA node fails to produce an appropriate rate or when the conduction system fails to transmit the impulse. And then you have permanent pacemakers. You have a single and dual chamber. They both monitor the heart and send out pacing signals as needed to meet the physiological demands. A single chamber pacemaker usually has leads to carry signals to and from the right atrium or right ventricle, and usually used for individuals who SA node sends out signals too slowly. A dual chamber pacemaker has two leads. The tip of the lead is at the right atrium, and the tip of the other is at the right ventricle. And this type of pacemaker can monitor and deliver impulses to either or both of the heart chambers. Um, this type of chamber is used when the conduction pathway is completely blocked. And then you also have pacemaker programming. So for a demanding pacemaker, it monitors your heart rhythm and sends electrical signals only if your heart is beating too slow and if it missed a beat. And with a rate responsive pacemaker, it will speed up, slow down your heart depending on how active you are. And so here, I just wanted to show you guys a picture of the different types of pacemaker. As you can see, on the upper right-hand side, you have the single chamber pacemaker, and then to the bottom left, you have the dual chamber pacemaker. So who needs a pacemaker? So the need for a pacemaker can happen at any age, although some infants require a pacemaker at birth. About 85% of people who need it are over the age of 65. Doctors mainly recommend a pacemaker for bradycardia and heart block. So a heart block can happen as a result of aging, damage to the heart from a heart attack, or other conditions that disrupt the heart's electrical activity. And other recommendations for a pacemaker are aging or heart disease that damages your sinus node's ability to set a correct pace for your heartbeat, or if you've had a medical procedure to treat an arrhythmia called atrial fibrillation. And there are other factors that can cause someone to get a pacemaker. So the effect of a pacemaker on exercise response. So most patients who have a pacemaker need to be enrolled in cardiac rehabilitation in order to improve their exercise capacity and quality of life. And one of the most important components of cardiac rehabilitation is physical exercise. So a program needs to be individualized for each patient by taking into account age, gender, risk factors, and fitness level. And then you have rate responsive pacing. So rate responsive pacing is used by individuals who need to sustain a heart rate that matches their metabolic needs to daily lifestyle or condition. So what this pretty much means is when you're exercising, there is a sudden increase that requires the heart rate to adjust quickly to the workload. So the rate responsive pacemaker can sense the body's physical need for increased cardiac output and produce an appropriate cardiac rate for them, as well as having a max sensory rate, meaning the pacemaker is set to a certain rate and the individual can't or shouldn't go above that rate. So exercise testing for a pacemaker. So there was a research done with 52 pacemaker wearing patients who were clinically evaluated and submitted to exercise stress tests. And what they found was that better function was observed in patients with a dual chamber pacemaker compared to a single chamber pacemaker. Also, observation should be considered by physicians when they program a pacemaker or prescribe physical rehabilitation. Also, you have two different types of testing. You have informal and formal. With informal, it's preferred due to it being less expensive. And with informal testing, the individual walks at a casual pace and then a brisk pace for about 3 minutes because the pacemaker can store electrical records of the pacemaker activity. There is a special computer used to examine the histogram of the heart rate response during the walk. So for casual exercise, the target heart rate is 10 to 20 beats per minute above the lower rate and 20 to 30 beats per minute for brisk exercise. And then with formal testing, it is recommended for active individuals who likely want to reach their max sensor rate. The protocol selected requires careful consideration, so it's called the chronotropic assessment protocol that's recommended for individuals with a pacemaker. The advantage of this protocol is the stage gradually increases to mimic the range of activeness at daily living. So this protocol allows a more complete assessment of how the pacemaker responds at a lower metabolic rate, where the individual usually spends more of their time at. And as you can see here, like I was saying in the last slide, this is the formal assessment. So here's just a graph of pretty much how it's set up. And as you can see, the stages increase, and then the speed and the grade all increase. So this is just pretty much to kind of show you guys what it would look like if someone with a pacemaker did a formal testing. So exercise recommendation for patients with a pacemaker. So improvements in aerobic capacity and health-related quality of life were similar in patient with and without pacemakers. So you have mode. So all forms are accepted except contact sports such as football, soccer, and hockey. They aren't recommended. All forms of aerobic exercise are acceptable and most likely carry the greatest benefit with improving overall health and decreasing risk of cardiovascular disease. When someone with a pacemaker performs any form of aerobic exercise, rate response pacemaker should be evaluated to make sure that they are increasing the heart rate appropriately to the intensity of the exercise. And then you have frequency. If someone is interested in improving their health and is exercising at an intensity of less than 60% of max heart rate, daily activity is recommended. If they are able and willing to exercise at a higher intensity, activity should be about 3 to 5 days a week. So then you have intensity. So upper limits of the pacemaker can influence the upper limits of exercise intensity because heart rate doesn't increase in an individual with a fixed pacemaker. So RPE and MET needs to be used to evaluate the intensity. Also, blood pressure should be monitored to show appropriate increase with increasing workload. Someone with a fixed pacemaker should not exceed exercise intensity above the point where blood pressure begins to plateau with increasing workload. So, with a dual chamber pacemaker and rate responsive pacemaker, heart rate can be used along with RPE and MET. And then with duration, that is just dependent on the goal, but it is recommended that the person does 20 to 30 minutes while exercising. And so here I have my case study. So I have a 56-year-old male, had sudden death syndrome, which required him to receive a pacemaker. He has a dual chamber pacemaker. Pacemaker cannot go above 250 or he will be shot. He has hypertension. His resting heart rate is 65 beats per minute. His resting blood pressure is 134 over 82. He is 5'5". He weighs 210. His BMI is 34. His goal is to be able to live a healthy lifestyle and to do daily activities, and he is on 3 medications. So my exercise prescription or program for him. So the first initial conversation would be his goals, and since I know his goals, I would test cardiovascular endurance. So for that, I would do the modified Bruce test. Um, For muscle strength, I would do 1 RM, but I would do that with lower body. Since I don't want to cause any problems with upper body, I would just stick to the 1 RM for lower body. And then I would, of course, do flexibility. So then here you can see I just have a chart of what I would prescribe him. So for aerobic, I would have him do that about 3 days per week. And as I said in previous slides, we can't measure heart rate. So with RPE, I would want him to be in the range of 11 to 14 on a 6 to 20 scale, and have him do about 15 to 20 minutes, and it would just be free walking or stationary bike, things like that. And then for resistance, I would have him do 2 days per week. I would have him slowly increase upper body activities after several weeks to month. And with lower body, we can begin at 50% of heart rate max. And that would just be 1 to 2 sets, 10 to 15 reps. And it would be weight machines, but he can use dumbbells, bands, things like that. And then with flexibility, it would just be 2 to 3 days per week. With stretch, he would stretch to the point of feeling tightness or discomfort, and I would have him hold the stretch for 10 to 30 seconds. And then just have him do some yoga, PNF stretching, static stretching, things like that. With his medication, he is on one medication that slows down his heart rate, that is a beta blocker. You just want to take into account his heart rate as he's exercising, since that medication does slow it down. You want to make sure the heart rate isn't going too low. And then he also is on a medication that is a blood thinner. So again, you just need to watch out for that. And then he is on a medication that is a diuretic, and that would be the most important one because he can get dehydrated very quickly. So I think we would have to, one, before he exercises, make sure that we see if he took any of his medication. But yeah. So special considerations for people with pacemakers. So with sports and rec, like I said, contact sports should be avoided. Also, if they go hunting, avoid bracing the ruffle butt against the implant site. And then with work activities, equipment with large magnets should not be carried if the magnet is um, near the pacemaker. Individuals who work with heavy industrial or electric equipment, they must consult with a doctor um, before going back to work after having a pacemaker, because that equipment can produce high levels of electromagnetic interference. And then with home activities, pretty much home activities can be the same except for cell phones. They should be kept 6 inches away from the pacemaker site. And then you also must hold the phone to the opposite ear of where the pacemaker is. And you should avoid using tools such as a chainsaw that requires the body to come in contact with an electric spark. And then with travel, again, you can travel, but you should tell airport security that you have a pacemaker to avoid triggering the metal detection alarm. So, in conclusion, with pacemakers, initial pacemakers operate at a fixed rate and were primarily used for individuals with bradycardia or high degree AV block. But because of the inability to increase heart rate with exertion, rate response pacemakers were made so that cardiac output can appropriately increase under physical activity. Also, individuals with rate responsive pacemaker, they should be monitored to determine whether the physiological response is acceptable with exertion. And again, patients should avoid contact sports. And then overall, there isn't much limitation to prescribing exercise in pacemakers other than making sure an appropriate physiological response happens with increasing levels of physical exertion. And then here is my citations.